Hey y'all, Yvonne, physical therapist here at His Therapy, wanting to bring you another video. And this one is what to expect when you come to pelvic floor physical therapy. And so the first question is, what exactly is pelvic floor physical therapy? And I like to explain it as if you had low back pain and you went to see a physical therapist. They would probably look at how you walked, how you sat. They would ask you all these questions about when it started and what it feels like. And then they would assess your posture and look at your hips. And then they would put their hands on your back and see how it's feeling, assess if it's tight, if it's too loose, if it's inflamed, how the joints are working together, how all those tissues are working together. And after their assessment, then they would treat whatever dysfunction they found. So they might do some trigger point release or some joint mobilizations. They might give you some stretches or some exercises. And then they would educate you on maybe why it's happening and some tips and tricks to modify your life to mitigate that pain and hopefully get you back to normal. The same thing for pelvic health. The only difference is that the muscles of the pelvic floor are inside of our body, inside of our bones. So we have to look inside. So for those with a female body, then we would use the vaginal canal. However, if they are dealing with some tailbone pain, then doing a rectal assessment, it might be in the plan, but it's typically not something we do on the first visit. But if you have a male body, the only way to really assess those internal pelvic floor muscles is through the anal canal. And we would do the same thing. We'd sit down with you first, we would talk about your symptoms, see how it feels like when it started, what's going on, and then we would look at the outside of your body. How is the whole body sitting on top of each other? And are there any imbalances that we can just see at eye level? And then we would do maybe an abdominal massage or an assessment first. And why? Well, because everything that enters our body and goes through our abdomen, through our gut, then exits out of the pelvic floor. So there's a lot of relationship there. So we would look at the abdomen, and then we would look at the outside of the skin. We would assess it, assess those bony landmarks. Is there any pain? We would see how you can contract and if it's visible from the outside. And then we would do an internal exam. Now for those females that go to gynecologists or obstetricians and they do internal exams there, the big difference from us is that we don't use any metal. It is simply just gloves, lubricant, and a digit, and that's it. So it's a lot more comfortable in that sense, but we get a lot of great information. PTs are all about what we can feel and do with our hands. We're very manual heavy, and there's a lot of information that we can obtain from that and a lot of help that we can provide through that. And so once we assessed, we would do the same thing. We would treat. I do a lot of trigger point release in those pelvic floor muscles. I do even some joint mobilization on the sacrum and on the coccyx and on the SI joint. I give a lot of stretches, exercises, breathing techniques. And then I talk about why this all happened. Maybe I notice some patterns in the history, what makes it worse, and maybe we give you some tips on how to modify the way that we live our life in order to improve our situation. And hopefully through all of that, through all these techniques and a couple of visits, then we can get you back to normal. Because I know from personal experience how pelvic floor dysfunction can really mess with your life. And so I love to help. It's a passion of mine, and I feel like it's a not so popular thing, but it is so needed because people really need that help, and it needs to be addressed just like any other part of our body. So I highly recommend giving us a call, talking to us. We have 15-minute phone consultations to see if this is actually something that's appropriate for you, and hopefully we can get you on the schedule and help you out. Thank y'all and have a great day.